Good morning, Professor Bolton. Good morning, ladies and gentlemen. It gives me a great pleasure to be able to host this important conference that is being held in collaboration with the Maltese Diabetes Association and with the support of Narrative Structures. I warmly welcome you here on behalf of the European People's Party for this conference on diabetes, which, as we know, is an issue of great concern to us all. It is a chronic condition with a very high prevalence, and when we talk of that, we are referring to an issue that affects 10% of our own population. It is certainly a great pleasure and honor for me to have been able to organize this conference under the auspices of Her Excellency Marie-Louise Colleiro-Preca, the President of Malta. Marie-Louise Colleiro-Preca and myself, of course, have been colleagues for a number of years within the National Parliament. And as colleagues within the National Parliament, before we both moved on our political paths to different venues, I can also attest personally for her strong interest in health-related issues, including the issue of diabetes. And that makes my privilege to be able to host a conference under her distinguished auspices even more relevant. It is then very fitting that the topic for today's seminar will focus on type 2 diabetes across the world, the 21st century epidemic. And why is diabetes an epidemic? Well, the latest figures issued by the International Diabetes Federation through the 8th edition of the Diabetes Atlas, which was launched last December, already speaks volumes. In 2017, there were 425 million people living with diabetes around the globe, meaning that 1 out of 11 people suffer from this chronic condition, whilst 1 of 2 persons remain undiagnosed. I believe, Professor Bolton, in your own intervention later on, even from what we have discussed earlier on, you will be referring to the strong need for early diagnosis, the strong need for widespread screening. When we refer to such issues, we need to also bear in mind that this figure is set to rise. And it is estimated that by 2045, the figure will rise to alarming 629 million. In Europe alone, whilst we speak of 58 million in 2017, that figure, again using the same calculation, the same barometer as it were, rises to 67 million by 2045. We are then speaking of, because some people think that diabetes is just a condition one can easily handle. But to talk of a more staggering figure, we are then also speaking of the impact of that, even when it is related to death as a cause of death. In 2017, nearly 500,000 people in Europe, aged 20 to 70 years, died because of this condition. Today's seminar has brought together the global expertise of Professor Andrew Bolton from the United Kingdom, and I have no doubt that he will give us much further insight on the challenges we are facing and how the medical world is responding to this. We also have with us Professor Stephen Fava, Chairman of the Diabetes and Endocrine Center at Mater Dei Hospital, and he will obviously be very much dealing with the situation in Malta. Chris Delicata, of course, who, apart from any other official title, I will refer to you as the Malta champion for the cause, the person who has relentlessly brought the matter to public attention over the past years. I kind of know Chris at a very personal level, even through family, and I know of his personal dedication, his personal commitment. I remember talks with him even when he was at the very beginning of setting up a process of awareness. And by and large, it relates to awareness. And thank you for doing that. Thank you for doing that at the Malta level, at the European level, at the international level, because Malta needs people like you. So he obviously will then be speaking about the work undertaken about the Malta Diabetes Association in addressing these issues. And I personally will very much look forward to all these interventions. The diabetes epidemic should be addressed not only by the healthcare professionals, but also by us politicians. Because as legislators, it is important that we constantly engage with the public on matters of national importance. At the end of the day, politics needs to relate to people issues. It cannot relate only to theory that is not related to what we experience in our daily lives. And diabetes, like all other leading health conditions, merit our support, merit our attention. It is for this reason that quite a number of years ago now, a European Union parliamentary working group was actually formed within the European Parliament with the primary mission of raising awareness of the diabetes epidemic among members of the European Parliament. Even politicians can suffer from being unaware. I can attest to my own experience of when World Diabetes Day was celebrated within the European Parliament on November 14. And of course, now being one of the co-chairs of this working group, it was my privilege to attend events related to that and also to be present for quick instant screening. And I undertook the screening myself together with colleagues. And to be told then and there that whenever this is carried out, there would be people, even within that institution, of course nobody is immune, that would be diagnosed for the condition, hopefully diagnosed early enough. I think that itself is an eye-opener. And we were literally asking colleagues, members of the European Parliament, staff members, assistants, people who work within that environment, come to this area, do your own test, participate, become aware, discover more what it is all about. But this we need to do not only on World Diabetes Day, but we need to do an ongoing basis. And that is very much what the working group is trying to do, to prioritize the subject on the European Union agenda, to map out concrete actions for change, to obtain the support of other members of the European Parliament. There are far more of us within the institution than the members who form part of the working group, but to raise, therefore, their awareness generally on diabetes and diabetes-related issues, to make them aware of initiatives that need to be undertaken, to maintain regular contact with them, and to provide them with up-to-date and accurate information. Malta has always contributed to this working group, and I'd like here to refer to the very positive and dedicated work of my predecessors on this working group. In particular, I refer to the work of Dr. Simon Busuttil and that of Dr. Therese Comodini-Cacchia, who were co-chairs of this group in past years during their own terms as members of the European Parliament. And that makes my privilege to be now one of the co-chairs of this working group even that much stronger. I co-chair with two members of the European Parliament from different political groupings, with Marisa Matias from Portugal, whom I know in another capacity because she was heading a delegation in which I participated to Lebanon. And she is very active within what we call within the European Parliament the Alliance of the Left. And Christel Schildemus, I always have to be sure I get this pronunciation right, who comes from the Social Democrat group, and he hails from Denmark. This will ensure that there will be a bipartisan, maybe I should call it multi-partisan approach, or an approach which transcends any political boundary in tackling diabetes as a serious health issue in Europe. As members of the European Parliament, we are strongly committed to the cause. We would like to represent the best interests of the people with diabetes in Europe and provide dedicated support and advice to the community in driving policy change. In March 2012, years of committed advocacy work by the European Coalition for Diabetes and the working group to which I have been referring was rewarded by one of their most important achievements when on the 14th March 2012, the European Parliament adopted by a large majority a resolution on addressing the European Union diabetes epidemic. It called on the European Union Commission and on member states to develop and implement a targeted European Union diabetes strategy in the form of a European Union Council recommendation on prevention of diabetes, on its diagnosis, on its management, on the need for further education and further research. I am glad to know that there was a parallel initiative by politicians in Malta. And then a few years ago, in fact, the House of Representatives established for the first time its own informal working group. This attracted the participation of 11 members from both sides of the House. That level of participation speaks volumes because it represents more than 15% of our total membership of Parliament. The Diabetes Working Group sat down to work in earnest and soon became a catalyst in pushing diabetes up the political agenda and in nudging the executive to adopt and implement a national diabetes strategy. The Diabetes Working Group has been able to rely on the constant presence and expertise of various stakeholders, and that was instrumental in developing a framework document on health choices, bringing together a set of proposals, again on health promotion, risk factor reduction, prevention, and optimization of healthcare resources. The momentum has also been triggered by the presentation of a new legislative bill in the last legislature on the promotion of a healthy lifestyle, which has since been unanimously adopted by the House. So Malta has its own healthy lifestyle law adopted unanimously by Parliament. I won't go as far as to state that it is being unanimously followed in practice or otherwise. But we have adopted it unanimously, and I still formed part of the national legislature when that was done. And that was a first in Europe. Now, as with many other laws, we obviously need to make sure we put into practice what the law provides for. The momentum which has been gained through that legislation is hopefully one that leads to further initiatives. And if I had to add a further thought here, our initiatives, be it in the national parliament, national parliaments of other member states of the European Union, the European Parliament itself, other European structures, international structures, is only effective when we carry out our work together with the stakeholders on the ground. And this is why, in an occasion such as that of today, it is always my privilege to say a big word of thank you to be participating here. When we set out to organize this event, the response has simply been phenomenal. We have had people, I am informed by Daniela, up to yesterday evening, right, telling us that they would like to join. And we said, well, please come along. So as you notice, we have a full house. And this is not only an audience of people who have an interest in the subject, but also an audience of many amongst you who are actively participating and making a difference about the matter. So it is really my gratitude towards all of you for being here. And our work at the political level is always far more effective when we are able to relate with civil society, with NGOs, with professionals, with stakeholders, with people on the ground, and with the people who ultimately matter, even with the patients who are suffering from the condition, with people who still need to know about the condition. Because the difference that we can implement together with you is far bigger, far more relevant than anything we can ever dream of achieving on our own. And this is a subject that certainly transcends, as I said earlier, at the European level, and as I made also reference to the Maltese context, transcends any political colors or boundaries. Well, mentioning color, but now I mention color with reference to diabetes, of course there is the color of the blue circle, which Professor Bolton is wearing for this conference. And it is a circle, again, to signify unity for diabetes. As policymakers, as politicians, we need to endeavor to work collectively together with the stakeholders. Our fight to combat the epidemic needs to continue relentlessly because every person, and this is the final thought, perhaps the most important, but every person who succumbs to this disease is a person who could have been saved. And that is really our task. Thank you once again for being here.